Welcome back, everybody. I am Meredith here with Intercept Treatment Foster Care, and we are back for our video interview series with Dr. John DeGarmo. We're so excited to have you back with us, Dr. John, and can't wait to dive in. Thanks so much for joining us again.
Oh, my pleasure. Thank you for having me.
So today we're getting into some really interesting topics and some things that we get asked about quite a bit here at Intercept, and wanted to just get your perspective as a foster parent and also as an educator and trainer, and talk a little bit about some of these are the tough questions, really the challenges that come up with fostering. And I thought maybe we could start with just sort of clarifying some of the differences when we start talking about foster care and adoption, and really what the intended outcomes of both of those processes, and maybe if you could touch on kinship care, returning to biological families. A lot of those things are a little confusing for folks.
Sure, it is. It is confusing for me as well. So when a child is placed into foster care, the ultimate goal always is for reunification. And reunification is when the birth parents or biological family members are reunified with the child, when the child is able to go back home. Does that happen all the time? No, about 50% of the time it does not happen. But in order for reunification to happen, the birth parents have to undergo a number of, they have to get a police background checks, and they've got to take parenting classes and meet their case plan. If that should not happen, then the parental rights are terminated. And that takes quite some time to get there. So I want to make sure people understand this. It doesn't happen immediately. It's a long process to get there. They give the birth parents ample opportunities to have the child reunified with them. And again, that's the end goal. That's all. It can be a very, very happy occasion to have the child and families reunited, the families heal, if you are. If the parental rights are terminated, which is known as TPR, then the child may go up for adoption. Now, the child may go up for adoption with biological family members, maybe grandparents, aunts, uncles, cousins, older siblings, if you will. And if that doesn't happen, then many times foster parents have the first opportunity, the first right, if you will, to adopt the child. We've adopted 3 children ourselves from the foster care system. We've had 4 failed adoptions, which means for some reason, whatever reason it may have been, the adoption did not work out. Sometimes they went back to biological family members. One time the adoption was sabotaged by a 17-year-old girl. So that happens as well. And there are thousands and thousands and thousands of children who are up for adoption every single year in the foster care system. Sadly, when they age out of the system, when these youth, when they turn 18 years of age in some states, or in other states it might be 21, when they leave the foster care system, when they age out and they don't find that forever family, if you will, the statistics are grim. 55% will drop out of school. 65% will end up homeless. 75% will end up in jail. And for so many of these children, these youth, the system will just repeat itself. And their own children will go back into foster care again. Indeed, 2 of the 3 I've adopted are 3rd generation foster care, which means birth parents and grandparents were also in foster care. You touched on kinship. Kinship care is when a biological family member, that grandparent, that older sibling, that aunt, uncle, cousin, if you will, cares for the child instead of the child being placed into a foster care home.
Okay, that makes a lot of sense. And you know, it brings to mind some of the fear I think that a lot of people may have going into the process, and they think, you know, I'm scared to get into this and then have either an unexpected or a negative outcome, or, you know, you mentioned some failed adoption processes. How do you prepare yourself? How do you prepare your other children, your family, for some of those changes and transitions when you're really just not sure what the outcome will be?
Well, you know, I hear all the time, Dr. John, I couldn't do what you do. It would hurt too much to give these kids back. It would hurt too much to become too attached. And I tell them this, that's exactly how it should be. That's how it's supposed to be, because these children need us. They need us to love them with all that we have. I believe children in foster care need 3 things: stability, structure, and unconditional love. Every child needs, deserves, and wants to be loved. So when we give these children all of our hearts, we give them that unconditional love, and they do leave our homes, yeah, our hearts break. But that's a good thing because it means we give the child what they needed, someone to love them. So for those people who are saying, you know what, I can't be a foster parent because I might become too attached, I say this. Please don't let that stop you. That's exactly what the children want you to do. They want you to become too attached to them because you might be the first person who ever becomes attached. You might be the first person who's ever loved them with all of your heart. And that's what every child deserves.
Yeah, that's a really interesting perspective. And I have to wonder too, I don't think anyone would doubt that parenting in general is hard on a family, hard on a marriage.
Right? Yes, yes,
It's
yes.
challenging, and I'm curious what some of the unique challenges are, in a marriage for foster parents who are new to foster parenting, or maybe even experienced foster parents who have seen children come and go out of their homes. Maybe some of the things that you've heard from community members or church members, and you think, I really wish someone had told me what to expect. What would you say to some of those folks?
Well, every marriage has its own challenges, unique challenges. It's normal. It's absolutely normal. When you bring children who are suffering from anxieties, suffering from traumas, suffering from attachment issues, trust issues, disorders, whatever it may be, when you bring them into a family, it's bound to it's bound to affect the family in some way. Each new placement affects the family in a different way because there's different dynamics. It's absolutely different dynamics. So yes, it can affect a marriage. It can add additional stress onto it. There can be a challenge of financial challenges, maybe a challenge of the child trying to pit one parent against another parent. There might be the challenge of the birth. Both parents may have different issues of discipline, if you will. You all of your attention. Sometimes you're not giving your own attention to yourself or to your own spouse or sometimes to your own children. So yeah, there can be difficulties and there can be challenges to a family and to marriages. And that's why I tell foster parents, you've got to look after your own family first. You've got to look after your own spouse first. You have to look after yourself first, because if you can't care for yourself, then how can you care for these children? If your own marriage is suffering in some way and you can't care for these children, and there are those times when foster parents need to say, you know what, I need to have a little bit of a break so I can focus on my own family.
Yeah.
And we've had those moments during the 16 years. We've said, time out. We need to have a little bit of break for a while and focus on our own family. And that's perfectly normal. It's healthy.
Yes. And something that we offer our foster parents at Intercept is respite care. I'm sure that's something that's pretty standard across the board. And a lot of folks don't realize that that's an option. And a lot of potential foster parents don't realize that they can become a respite care provider. Can you speak a little bit about your personal experience with respite?
I love respite. I love respite. I love being a respite, and I love having respite care for the children in my own home. It's absolutely necessary and can be a wonderful tool. There may be those times where a foster parent is burned out, is exhausted, is sick. Maybe they have to go out of the state for a wedding or a funeral or a conference. Perhaps they need to spend some own time with their own children. Respite can be a wonderful tool and a wonderful resource for foster parents and families, even if it's just for a weekend. It also helps a child as well, because a child just might need to get out of the house for a while as well. And for those foster parents who feel guilty about using respite, and I hear it often, I don't want to place my child into their home. They may not be able to trust it. I say, you know what? There are those times when respite is the healthy choice for all involved.
That's great. And, what are some of the other tools and resources when it comes to burnout, or something that, you refer to as compassion fatigue? That's something that we hear about a lot, and it can bring up a lot of fear and anxiety for potential foster parents, the fear of burnout. Can you talk a little bit more about that?
Sure. I spent about a year and a half interviewing foster parents across the country, what they wanted to learn the most about. And I wrote about it in the book, The Foster Care Survival Guide. And that main thing was burnout or compassion fatigue, secondary traumatic stress disorder. Sure, foster parents do get burnout. It's an exhausting job. It's really 24 hours, 7 days a week. And many people don't appreciate that outside the foster care system. Again, you've got to look after yourself. You got to take care of yourself. Make sure you're getting enough sleep. Make sure you're getting a healthy diet. Make sure that there are checks and balances in place. Make sure that that you allow yourself time to grieve when a child leaves your home. That's what happens to so many foster parents. They immediately take another child into the home. Immediately take another child into their home after one has left. They don't allow themselves time to grieve in a healthy fashion. And that causes burnout as well. And that leads to compassion fatigue. And that's when foster parents say, you know what, I can't do this anymore. Mm-hmm. There are those times when they need to say, I need a break.
Right. And, speaking of the transitions, can you talk a little bit about how that looks for members of your extended family, or maybe what you would tell your biological children about the process? I hear a lot of times, and something that we talk about in our blog is that sometimes you may hear some unfriendly comments or sort of uneducated comments from either community members or extended family. They don't really understand the process. How do you handle those tough conversations?
Well, we need to get something straight. No one understands a foster parent like another foster parent. Mm-hmm. I've been doing this for 16 years. I've written 10 books. My own family members don't understand it. They don't get it. So many people just see a revolving door of children being placed into a home. They don't see the attachments that are being made. They don't see the challenges that occur into it. They don't see the family bond that grows. They don't see that these are members. In my house, there's no label. There's no biological, adoptive, or foster. They're all my children. They're part of my family. Whether they leave or not, they're always going to be a member of my family. And that makes it challenging. You know what? That's just a stigma that we as foster parents are going to face all the time, because no one's really going to really get it unless they're doing it. Again, I as I mentioned before, I didn't understand what it was like being a foster parent either. So, that's a hard part about being a foster parent, is so many foster parents feel they don't have, no one else is going through what they're going through. And that's why I say you need to connect yourself to some type of support group.
Yes. And something we offer are local support groups. Where it's either a closed Facebook group where folks can sort of just convene and share tips, or, sort of vent to one another, but just to say we're in this together. And I think
laugh together, cry together, vent, if you will, share frustration, learn from each other, gain from past experiences. They're essential. They are absolutely essential. Foster parents must connect themselves to some type of community or support group. And if you folks are doing it, that is fantastic.
Yeah. I always think, if you can have a mentor or someone to look to who has maybe a few steps ahead of you, who's done it before, and can let them be sort of a guidepost for what you can expect, that's always really helpful. And, something else too that a lot of folks are curious about is how much contact they can expect to have maybe with a biological family. And I know it's different in every situation, but that can be a challenge. Can you speak?
It is different in every particular situation. You're absolutely correct. Sometimes they may have visitations once a week. Sometimes it's twice a week. Sometimes it's once a month. So it really depends. Sometimes it's not at all. So it really depends upon the individual situation and case. Again, the end goal is reunification, so that's part of the process. Can there be difficulties? Absolutely. But as foster parents, we need to make sure that we pass no judgment upon these birth parents that our children are seeing. Now, we might feel some resentment inside for what they've done to this child, but we can absolutely not show that to the child. Who are we to judge? We cannot judge these people. So it's important that we don't do that. We need to be opening and welcoming and answer their questions and try to be understanding and listen to their concerns, because these birth parents have concerns. They have questions. How is my child doing in that person's home? Is my child being taken care of in that foster parent's home? Are they treating my child nicely in that foster parent's home? So we need to reassure them, and that helps the healing process as well.
Yeah, I think that really speaks to what a collaborative process it is, not only working collaboratively with biological families, but also the caseworkers, your staff that are here to support you, your trainer, anybody that sort of can lead you through the process, and also just help make for a smooth transition. So that's really, really helpful and a great perspective. And thank you for helping us tackle some of the tough questions. This is always really helpful and great information. And we'll speak with you very soon. We've got some more topics to get into.
Great.
Really appreciate your time. Thanks.
My pleasure. Thank you.